Today, we're taking you behind the scenes inside of Las Vegas's most advanced regenerative and wellness clinic. Today, I'll be joined by American Medical Wellness's lead medical director, Kenneth Tan. Together, we'll discuss regenerative peptides, longevity treatments, as well as, most importantly, what you can do today that's going to help improve your overall health and well-being, and most importantly, age gracefully for the future.
Right. So when patients come in and they don't have like the necessarily optimized life, what are you looking at whenever a patient first comes in the door to your clinic to help them achieve not necessarily living forever, but like you said, higher quality of life while they are?
Yeah, so the evaluation process, I'm not gonna say it's easy because it's different for every person. However, what we do is bring a patient into our clinic. We want to check labs, and there are markers, at least the basic ones first. The basic markers just tell us like maybe the hormone levels, make sure they're healthy otherwise from a primary care standpoint. But then there are other extensive labs we can do, and in-depth hormones. We can actually do epigenetic testing. We can look at other different hormones. So we know that the basic ones, if I have to guess, 70-80% of the work is done from the basic labs. But there's another 20% that don't feel good that we have to focus on. And those are what we're trying to find out is what drives everybody, what makes everybody different. So there's no cookbook medicine to fix this.
Right. So this isn't just a one-stop, one answer fixes everybody's problems. It seems like it's going to be more on a patient-by-patient basis where you're specifically dialing in all those factors you just mentioned, your hormones, your levels of everything that you're testing and going through with each patient. Is that right?
Correct. My job would be a lot easier if I could just do labs on everybody and just prescribe medicine. However, it's not. It's individual medicine. It's practicing medicine. So we want to figure patients out what makes them tick. And then that's the difference for everybody. That's why it makes my job a little more difficult than others. But we want to get that individual attention to make sure we actually meet the needs of every patient here at the clinic.
I'm sure that goes a long way with the patients. So for somebody who's not necessarily a patient right now, but is hearing this conversation and they're like wondering, do I have these symptoms? Are my hormones balanced? What would you say is like some of the easiest flags without blood tests to kind of, know that something may not be right with it?
Absolutely. I mean, I can tell you the biggest step is probably when you start in your 30s, but the hormonal imbalances, when you have old hormones, whether female or males, you already know my energy level is not as good. It's harder to lose weight, meaning you don't change your diet, but why am I gaining weight? Because most people are a regimen where they eat the same thing for years in, year out, and they start gaining weight. So it's your fat metabolism. So, I mean, I would say those metabolic markers of mood, energy, muscle loss, those are things that I would say right away are red flags. Maybe you should get checked out.
Come in when you're a creature of habit and you're doing all these things the same for years and years of your life. And then all of a sudden, hey, why am I so tired? Why am I losing muscle? Even though I'm doing the same things I've been doing my whole life. You're saying like that's when it's like this may not be something that you're doing. It may be your body needs an assistance.
Correct. And it is, because think about it. Like I know there are many medical providers out there that say, what do you want me to do? It's aging. It is. But I always challenge patients on this isn't the goal is to feel younger and to slow down aging. This is why we're looking at these metabolic markers.
Makes complete sense. So I'm sure something else that kind of ties into a lot of this would seem like would be peptides. I know that's everywhere right now. Do you work with peptides at all? How have you used them in your practice?
Absolutely. So the first thing is peptides. I know sometimes we're looking at the market right now, a lot of gray areas of research peptides. I'm going to say our clinic, we only actually go through a compound pharmacy, a 503A pharmacy currently, and it's regulated. We want to look at sterility. You want to make sure it's safe. You want to make sure the efficacy, it's going to work. And after 30 days, is that compound still going to be 99% of the medicine still going to be in there to use? So I do like peptides. And if you don't know what peptides are, it's out there. Chain amino acids, they're as natural as they get. I'm going to say it gets your body to create a workflow in you. Meaning, if we want to increase your testosterone levels with a peptide, it gives a good kick to your adrenal glands to try to make more hormones. Does the same thing for growth hormone levels to burn fat. So there are multiple ways. There's some for inflammation. There's some for the immune system. There are a lot of different peptides. It depends on their approach.
Right. So there's a wide variety of things that peptides can do. Is there something specific that you try to focus on when you're looking at a patient who says, I want to get on peptides, they kind of have an idea in mind of what they want. Do you still follow up with your lab work and check these patients and make sure like that their levels are correct?
Absolutely. So at the day, this is a medication at the prescribed. So there has to be an intended use. And you're right. The goals of the patient is very important. But I use an analogy here. If someone's trying to burn fat, but their growth hormone levels are super high, well, I wouldn't pick a peptide to give them the growth hormone just because the patient wants it. And you find out there are other ways to do it. And there are probably other peptides that'd be more efficient. So that's why the evaluation process of blood work is so important. If you're going to actually look at what peptides to pick, we do this every day. And
that's back to what you were saying with the individual patient basis, right? It's like
correct. And that's
cookie cutter.
And that's why I would even say is going to, when say we do a higher level testing, like epigenetic testing, that's to tell you basically what peptides to take. However, it will tell you from your DNA what things you should be eating, what things you shouldn't be eating, what vitamins you should be taking. And then it lets me create a list of all your weaknesses so I know what peptides to strengthen those systems, like your body systems that we need.
Not a blind guessing and checking. This dialed-in approach for anti-aging, essentially, from somebody.
Correct. A very visualized approach. That's what we're trying to focus on here.
Incredible. So as far as anti-aging goes, what other kind of treatments do you offer that will help somebody who says, I want to take, I want to feel 10 years younger?
So, well, that's a loaded question, but I say I'm going to just mention a few different therapies here we have here. From we're talking about using like things like EBU, which is a plasma exchange and cleaning out the inflammation in your blood, putting UV light back into it, giving ozone to the blood and pushing it back. That's great because that takes the inflammation. That's one way to do it. But there are different ways to skin a cat. And I'm going to say this, I also love our IVs. We have IVs that can do the same thing. We're high dose vitamin C with glutathione, and we call it our Myers cocktails. And that's going to be good for your brain because there's B12 vitamins in there that you may need. Third thing I would say is probably cheap and easy. And I know cheap and easy is a word that we use a lot, but that's easy for me, I'm going to say. But like I said, getting a membership where you can do something like hyperbaric oxygenation.
I've heard about that. I heard that we have that here. Like, talk to me a little bit about the hyperbaric oxygen chamber. That seems like
so. People, if you Google it and you're aware of that, what hyperbaric does is, when I first learned about it, I'm going to say many moons ago, we used it for wound care. So we put people with like burn victims into hyperbaric oxygen therapy to actually get more oxygen so their wounds will heal a lot faster. Well, it's the same thing. You're putting more oxygen into your tissues so you can recover better. Your skin looks better. You can heal better. So if you can use it for injuries. So you don't take any medications. If you get more oxygen in you, you pull a back muscle, theoretically, you can actually heal a lot faster with more oxygen in that tissue.
So this is a wide use application for, it seems like everyone from athletes to, like you mentioned, people that were injured or burned or.
We're seeing more and more patients, and I can say that we have a clinic, and we're booked solid for 8 hours a day now using this machine, and people are finding out about it. It's a regenerative way to do it without even taking peptides, hormones in a way just to feel better. So people are really like understanding this better. And there's other ways you can do it, like cold plunge, red light. There's red light therapy we have our clinics. There's saunas you can do. So any way to decrease inflammation, get better blood flow in you, your body's going to function better, heal better, can work better.
Decrease inflammation, increase blood flow, live longer?
Yes, absolutely.
Awesome. Well, thank you, Medical Director Tam. I appreciate your time today. Hope you have a great rest.
Fantastic. Thank you so much.